This unit's the result of a major investment by the Health Foundation, which is born out of an independent review of health and health inequalities, which was commissioned in 2021 and published a report, Leave No One Behind, in 2023. The review revealed widespread support for greater independent voice and scrutiny in relation to Scottish policy debates on health and health inequalities. The report highlighted a number of underlying factors which have contributed to the persistence of health inequalities over that decade before the pandemic, notably the accumulation of severe and multiple disadvantage, a lack of improvement in living standards, and austerity, which has left public services in a fragile state and unable to sufficiently support building healthier lives.
Living standards for quite a lot of people in Scotland are falling far below where they need to be for people to lead a healthy life. Rather than waiting until people's health fails, what we are focusing on is interventions that can prevent these harms from happening in the first place. Our job is to provide practical and useful data and insights to help policy development and also scrutiny of government decisions. We are totally independent of government, which means we have the freedom to look at what we think is important and say what we think needs to be said. We think our expertise will really come to the fore in our understanding of how policy and government works and what is needed in order to make more effective policy decisions.
There's 4 key types of work that SHERU will be focusing on. We'll be producing commentary and analysis on new policy developments and research. We'll be working to improve data that connects socioeconomic factors to health. We'll be trying to focus on stakeholder engagement and linking up stakeholders that are working on key socioeconomic areas like housing, employment and economy to the various stakeholders focusing on health issues.
We'll also be taking a close look at the gap between the Scottish Government's stated ambition
to reduce health inequalities and the reality of persistent, wide health inequalities. And we'll be doing that by looking at 2 key policy areas. So we're going to be focusing on housing and employability. And for each of those areas, we're going to be tracing down Scottish Government commitments and looking at how those are operationalised and implemented. And we'll trace it right down to community experiences. We'll also be working with communities to understand what changes they would like to see and what kind of policy changes would need to take place to enable that. And we'll be taking those insights back to the Scottish Government.
Our hope is that by providing robust and independent analysis, insight and commentary, SHERU can help enable better policy and more successful implementation of policy. And to do that, SHERU needs to help Scotland close the gap between undoubted policy intent and policy impact and the real-life experiences of people in communities across Scotland.
We also want to help other people who are interested in health inequalities participate in the debate. So we'll be publishing lots of information on our website, so do sign up to our mailing list if you want to keep up to date.